Hello, my dear friends. I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today we're going to talk about foot drop, also called peroneal palsy. So let's take a look at a case. A 25-year-old man came with a history of recent trauma to the lateral aspect of right knee in a RTA, road traffic accident. Symptoms: immediate weakness on lifting the foot, difficulty in walking, numbness or tingling on top of the foot. Examination findings: weakness or paralysis of ankle dorsiflexion, decreased sensation on the dorsum of the foot, tenderness around the fibular head. I'm sure you already know what has happened to the patient. Let's now answer some questions. Name the condition, explain the weakness of dorsiflexion, reduction of sensation on dorsum of foot. That's the question. Right. So what is the condition? You're right, it's foot drop or peroneal palsy. Now, how do we explain the dorsiflexion? How do we explain the loss of sensation on the dorsum of foot? So we need to explain motor loss, we need to explain sensory loss. Okay, come. So now here we are looking at the gluteal region from behind. It's been dissected. I can see this is the sciatic nerve, this is tibial nerve, and this is the common peroneal nerve, the two divisions of sciatic nerve. Now you observe the common peroneal nerve descending downwards, dividing into a deep peroneal nerve and a superficial peroneal nerve. Here you are seeing the same nerve that is winding around the neck of fibula, deep to the peroneus longus muscle, dividing further into deep peroneal and superficial peroneal. So, points to be noted: common peroneal is found at the neck of fibula, deep to peroneus longus, dividing into deep peroneal nerve and superficial peroneal nerve. This is a section through the leg, and you can see that this is the flexor compartment, that means your calf muscles. This is your extensor compartment, and this is your peroneal compartment. So now let's talk about this nerve getting injured at the neck of fibula in the road traffic accident. So what will be injured? The deep peroneal nerve will be cut, the superficial peroneal nerve will be cut, which are the two terminal branches of common peroneal nerve. So, deep peroneal nerve supplies extensor compartment. Superficial peroneal nerve supplies peroneal compartment. So, that means which two compartments are gone? Extensor compartment is paralyzed, peroneal compartment is paralyzed. Right. So, now this is your extensor compartment consisting of tibialis anterior, extensor discorum longus, extensor hallucis longus, peroneus tertius. All four muscles cross the ankle joint anteriorly and are dorsiflexors. They are supplied by the deep peroneal nerve. So if your deep peroneal nerve is damaged, then these four muscles are paralyzed. They are all dorsiflexors. Therefore, what sensation, what activity will he lose? He will lose his ability to dorsiflex his foot. Clear? Explains the motor loss. Now let's take a look at the skin. Over here you can see this is the superficial peroneal nerve spreading out to supply the dorsum of the foot, and this is a tiny bit of deep peroneal nerve also assisting. So we know superficial peroneal is cut, we know deep peroneal is cut, and therefore sensation on the dorsum of the foot is going to be lost. This explains the reduced sensation on the dorsum of the foot. Okay, right. So the patient has initially in a normal foot has ability to dorsiflex the foot. In case of foot drop, his foot just drops down, unable to dorsiflex the foot. So that is the condition of foot drop. Now let's see if you can write a note on foot drop using this information. Define what is foot drop. Explain the causes of foot drop, usually a road traffic accident or some kind of direct trauma on the person's leg. What are the symptoms? Difficulty in lifting the foot off the ground. The foot just falls down and the patient develops a slapping kind of gait. Okay. Plus there is also a sensory loss on the dorsum of the foot. So those are going to be symptoms. How will you treat this patient? There will be a physiotherapy required. There may be surgery required in case of a larger trauma, and depending upon the cause and severity of the condition. Conclusion: in case of symptoms of foot drop, patient must consult healthcare professional for proper diagnosis and treatment. These are the commonly asked questions based on this short video. I'll see you in my next video. Bye. Thank you.